Hi everybody, it's Friday night. I'm Kathy Van Ness. We're at the Golden Door and we're on our speaker series evening. We're going to have some fun tonight because we're going to talk about Chinese medicine versus Western medicine. What does it all mean? What does it all say? And we're so honored tonight to have with us Dr. Michael Corradino, who you know. He's a doctor of acupuncture and Oriental medicine. And he's the founder and CEO of Neuropuncture, try to say that 3 times, graduating from the Pacific College of Oriental Medicine cum laude in 1995 with a master's degree in traditional Oriental medicine. Dr. Corradino's goal is to introduce this medicine to as many people as possible in his lifetime to prevent an effective quality option for health care. Last year, Governor Edmund Brown, congratulations again, appointed Dr. Corradino to the California Acupuncture Board. So for those of you who know Dr. Mike, he's here on Mondays helping our guests with sleep. And he's really done a good job of getting that week started out right. So, Mike, Dr. Mike, where does traditional Chinese medicine come from?
Well, it comes from China, yes. You'd be surprised.
But it didn't really.
No.
It actually didn't. I'm going to ask the question actually differently, because you're going to answer it differently. Prehistoric medicine incorporated plants, animal parts, minerals, and societies before they extincted from the earth, believed this prehistoric time just after the dinosauric period, believed in both the natural and supernatural means of curing and treating disease. Early records on medicine were discovered with ancient Egyptians. And we must remember that everybody started in Africa, not in China. I know they might think they did, but they started in Africa. And so this history of Chinese medicine begins in the 2nd century BC because there's no even clear records of medical techniques that are currently older than that. There exist written descriptions about disease from the Shang dynasty, but there isn't any record of their medical techniques either. So if truly everybody came from Africa, which is what is the record, and actually evolved through Egypt, how did the Chinese get such the recommendation for having Chinese medicine?
Sure. So for starters, about the rifts of Africa, yeah, it's true. Genetics and biology, evolutionary biology states that we came from the rifts of Africa about 250,000 years ago. The reason is a very interesting understanding of how the planets revolve, and at a particular time, after about almost every 500,000 years, we have a specific orbit that puts different pressures on the Earth. And at that particular time, yeah, there was a jump in evolution. And that's where humans did come out of. So Africa and the rifts about 250,000 years ago. Some say a little bit longer, but it's definitely around 200. So from there to China, yeah, it's a big, change, and I'm sure
big leap.
The whole, where that all came, that's a lot to really still investigate, I think. But Chinese medicine has a written, recorded history of 2,500 years ago. That was the first recorded text called the Huangdi Neijing, the Yellow Emperor's Classic to Internal Medicine. And that is what I think you were discussing, how that book incorporates the concepts of a spiritual connotation with treatment, but also a very strong relationship with humans to nature. And that delicate balance that they saw in nature from seasons changing to seasons is a delicate balance that also occurs in the human body.
So what made you in your early career decide that you actually went to China, right?
Yeah, studied in
and
China.
You actually studied there.
Yeah.
I mean, it's a pretty big belief to say I'm going to kind of like sidewind from medicine that's Western and study Chinese medicine. What took you there? So
I was born with a heart condition. I was born with a valve that was a little dysfunctioned or deformed. And my father he's a Superior Court judge, but before that he was a very well-known attorney and litigator. And I think physicians would never sign off on my physical, so I was never able to exercise. But when I turned 18, I could do whatever I want. I signed my own waivers, right? So I got into martial arts. I wound up becoming ranked 2nd in the world, 1st in the West Coast in Lei Thai fighting. Got my 2nd degree black sash, and I studied many arts since then, but martial arts is what I got introduced to Chinese medicine through that. And when I discovered that I can, after college, I can study a 4-year master's degree and study Chinese medicine, acupuncture, mind-body training, herbal medicine, anatomy, physiology, all these wonderful things, and then study martial arts at the same time, I could do that for the rest of my life.
Well, so
that's a dream.
Which sounds pretty, I agree, that sounds pretty, so what was it like how old were you when you went to China?
I went to China when I was completing my doctorate degree. So I went to China in 2000, I think it was 2005.
So what was it like to be a Western person and going into that culture, which is quite complicated and crowded and hard to sometimes understand?
Yeah.
What, was it easy to just sort of like grapple with the language barrier and to understand what was the education?
Yeah, I studied Chinese language in my undergrad studies, and I also studied in my master's degree and in my doctorate degree. But it's still difficult to definitely understand
Especially for
and
Westerns.
communicate. Yes, it is. We did have a translator there, but what we did notice, and this was really interesting, is the same principles hold in martial arts, where you have a teacher and he has these secrets or these certain training principles, and he passes on only onto the black belts, and then they get watered down or taught as the students rise in their training. Same thing with Chinese medicine. You know, the masters there that we studied under, you know, some of them were very hesitant to teach us certain things because we were Westerners. And we noticed that there were some mistranslations. So our translator, who was a good friend of us and traveled from Europe to meet us in China and translate for us, he's a doctor of Chinese medicine and a medical doctor. He's very talented. And he would correct the head students when they were trying to teach us different things that the master was telling us.
Oh my gosh.
So there were still some, you know, privacy and, you know, hold on to their secrets.
Well, in the West, we tend to think of medicine as a way of dealing with illness and disease.
Exactly.
In contrast, traditional Chinese medicine focused on achieving health
Yes.
and well-being through the cultivation of harmony within our lives. In your experience, you've been practicing this for many years. In your experience, what's been the most effective use of Chinese medicine in your practice?
Oh, that's good. There's a lot of really
we wanna
powerful
know.
uses.
We want to know.
I think the main difference, and this is what I emphasize, and this is what's so, I think, powerful with Chinese medicine, is we try not to treat diseases. Diseases are manifestations of a system that's imbalanced. So we treat is the balance, is the system itself, and creating harmony in that balance. And what's really important is that exactly that, Western medicine treats disease, you know, and Chinese medicine treats the body and the human body to try to correct any pathology. Where I've seen that most effectively treated for sure, and I just came from my practice today where I saw many patients, and it really, I got this question from my patients, and it is those cases that are undiagnosed through Western medicine, where they're not sure what's going on, they don't have anything on a blood, you know, on any blood markers or any kind of MRIs or CT scans, but the patient has either pain or chronic fatigue. I just had a veteran that just came in today, and he fought in the Iraqi war, and he had multiple vaccinations, as you can imagine, from smallpox to even anthrax. And those are toxins that go in the body. And they have no diagnosis for him, but he has chronic pain, he has chronic fatigue.
So what do you give him for that?
Acupuncture and herbs. So the acupuncture.
So what kind of herbs? Just out of
the herbs,
curiosity.
you know, every patient's different, but what I do is I assess the patient and find out exactly which system in his body is not functioning properly.
Is that through some sort of a test?
Excellent. We use the 4 pillars in Chinese medicine, the 4 pillars of diagnostics. First one is questioning, right? So you ask the patient questions to get information. Second one is listening. So we listen to, you know, heart sounds, lung sounds, stomach sounds, but also listen to the patient's voice. If they have a cough, is it a hard cough? Or is it just like I got this little dry cough? So listening to the expression of the pathology too, if we can. And then there's touching or palpation. So palpating the body, doing exams, but also palpating the wrist. The radial pulse to us is like our MRI. And then the last one is looking, and then we examine the tongue, examine the face colors, and the ears is a landmark for me that I love to look at for diagnostics. And then we take all that information.
Do you find yourself able to perhaps see things that you would not have normally seen in a Western practice?
Absolutely.
So what would, and wouldn't the Western practice doctor be doing the same thing?
Sure. So actually, great, you know, in Western medicine in the 1920s, from my understanding, there were about, I think, 18 pulses that they examined and felt for. But now with technology, the doctors really have lost those skills. And in ancient China, you know, 3,000 years ago, because the medicine dated 2,500, but dates back about 5,000, so it does predate Egyptian medicine. They didn't have MRIs, so they had to study the body's landscape and see what it was telling you. And by examining the body, the ears, the tongue, the pulses, the nervous system will express itself on the body. And if you have the astute eye to look for it, you can see pathology and what's going on with it.
I was going to ask this question differently. You're best known for pioneering interactive medicine. So what's your opinion on your practice? Are we taking too much medicine?
In some cases, absolutely, absolutely. There's always a need for medicine. I'm not ever trying to tell anyone to get off their medications, and there's always a place for it. But we know America, pharmaceutical companies are very powerful. They have strong lobbyists, and they really run a lot of the financial and economic and political arenas. And they are way overprescribed. Where do you see, I mean, even look at some of the interesting commercials we have. Ask your doctor for this. Why should a patient be asking a doctor for a drug? It's his job,
What
right?
about the one that says, "Are you depressed?" I mean, by the time you look at that commercial, I'm totally depressed. I had all those symptoms, every single one.
Right? Yeah. So are patients overprescribed drugs? Absolutely. But I think, unfortunately, it also lies in that there aren't any answers for Western medicine for them. You know, it's either drugs or what? Surgery? You know, they don't really have so many tools to work with. You know, that's how they're trained, unfortunately.
Well,
Now that's a bad doctors are
no. But you know, when you think of the therapies in your practice, so that our guests can kind of get a sense of what really happens in your day.
Yep.
As a Chinese practitioner,
Yeah.
Give us some examples of therapies that you handle today.
Sure. So some of the things that I love to do in my practice and things that incorporates Chinese medical theory is obviously acupuncture. I use a very specific style of acupuncture called neuropuncture. It's a system that I personally created and developed based on my research and investigation into the neurophysiological mechanisms of acupuncture. That's how acupuncture works. It's a great way to really amplify and maximize acupuncture's benefits. So acupuncture is a real powerful tool. Herbal medicine is another big powerful tool that I always use on my patients.
So how many of your acupunctures did you do today?
So about 17 patients today.
17 acupunctures?
Yeah.
Is that
all
like
my
a
patients
lot?
I do acupuncture on.
Is that like a lot?
Yeah.
Wow.
Yeah, I love it though.
And
It's
is
great.
acupuncture just a sort of a standard practice? These are the touch points that you've got to hit, or does obviously it seems logical that maybe every body would be different.
Everybody's definitely different.
Right.
But let's say if I'm treating a patient
Are there
for
like basic patterns, like this is what you need to
protocols. There are certain protocols that I actually teach based on neuroscience that we can measure the outcomes. So for example, Parkinson's, there's a great protocol that I use. It's 2 acupuncture points that I connect a little bit of electricity to, and at 15 hertz, it's shown to increase tyrosine hydroxylase in the brain. What does that do? Well, the pathway of creating dopamine, which is important for Parkinson's, tyrosine has to get broken down by tyrosine hydroxylase, which forms L-DOPA, and then L-DOPA creates dopamine. So when patients have Parkinson's, they have low levels of dopamine, and by giving them a supplement of tyrosine, and then hitting those points to break down the tyrosine, produce dopamine, those are protocols I like to use. They're based on neuroscience, so I know I'm affecting the patient's physiology.
Does the patient have to be sort of like prone to accept it? I mean, could a patient sort of say, "Oh my gosh, you know, whatever, I don't feel a thing"?
Yeah, well, that's
you know
two
what I'm
interesting
saying?
questions. Yeah, you know, I don't really like to say this, but you know, not everyone likes to get stuck with pins, right? You know, so
I mean,
there
do they
are
believe
certain
it? You're laying
patients-
there and it's a new patient, it's the first time you're doing it. What's the expectation of that patient the first time they visit you?
Well, I always go over that with them, what are the patient's goals. But the treatments are very comfortable. Most of my patients fall asleep. They report getting their best sleep in my treatment tables because it's just comfortable. And the acupuncture releases stress in the nervous system. So it just really helps unwind and balance and modulate the nervous system. So patients under the treatment, they tend to relax. And I use heat lamps, you know, and herbal sprays and stuff and some fun stuff.
Well, it sounds like, you know, a much healthier alternative, both Chinese medicine and herbs, teas and things like that. Why wouldn't more Western doctors perhaps mix it up in their practice? Is it possible there's a halfway point?
You know, the halfway point is someone trained like myself working with Western medicine practitioners, because it's too much for them to study all this. It really is. I've been studying my whole career. I've been practicing over 20 years. And I work with patients with medications. I know how to navigate through that so there's no side effects. And you have to remember that a lot of our pharmaceutical drugs came from herbs, you know, so they see the end result. This compound has this effect on the body. But for them to study where those herbs came from and then maybe to start to change their process and thinking on how, it wouldn't be, it's not for them.
Well, you and I spent some time at this incredible place looking at vitamins, and I got this
Yes.
incredible insight into the world of supplements and vitamins.
Yep.
Would you be able to answer the question that, is there a quality control on this?
Of course.
Is there better herbs and less better herbs? And how would our consumers, how would our guests know that they're getting something that would really be healthy?
Well, for starters, I would always I'd urge everyone to get your supplements, whether it's probiotics, fish oils, or any herbal medicine particularly, from a healthcare provider.
A real like doctor person.
No, a doctor or a physician like
physician,
myself,
right.
or a chiropractor or a naturopath, or anyone that can get supplements that are what we call nutraceutical companies. And those companies, third party, independently test them. They're quality controlled, they're batch consistently tested to make sure what's on the label is in the pill, from pill to pill, from pill to bottle, because they're only sold through healthcare providers, so they don't have to worry about spending money on the label or competitive pricing so much. We know what it's for, we know how to use it, and those are the best way to get your supplements for sure, hands down.
So ancient civilizations are documented, that have been documented to use all kinds of practices, from tree bark to meditation, in order to combat disease and improve clarity, even contributing to a healthier existence. Does any hard evidence exist indicating it actually works? And can healing methods used in simple ancient times provide the relief you need in today's quite threatening surroundings? The world is quite more toxic.
Sure.
You know, what we read in the newspapers every day, either through technology or how about water and
Flint.
Yeah.
Yep.
In Michigan, which is a real challenge. So how, let's go back and think about, does it really work?
Absolutely.
Would it help solve these threatening issues?
Absolutely. Now, it's not going to clean water, right? But, absolutely, there's a lot of evidence-based medicine that comes from Chinese medicine. Evidence-based means it's been through clinical controlled studies and has shown efficacy and measurable improvement, enough for it to be applied, and it's covered by insurance. It's in the workers' comp forum, and the veterans use it. So for those organizations to embrace it and to at least offer it, it's because there's been enough research to verify its effectiveness. Acupuncture by far has plenty of articles. That's what I do. I research that. I actually involved in studies and research, and there's plenty of evidence for acupuncture. For different conditions, it may vary, but there's definitely plenty of evidence of how it works and on a very physical level. Same thing with herbs. There's a lot of trials out now that have confirmed the pharmacokinetics, how the herbs work in the body and on what systems, and how to apply that.
Are there studies to say that teas are better than pills or better than eating leaves, I would assume?
Well,
is there some method of distribution that's more powerful?
Yeah, I would always say the teas tend to be the most strongest, the most powerful. But for convenience sakes, now we have concentrated granules, which are great. And I give that to my patients and take a couple scoops, put some boiling water in it, make it into a tea, let it cool down. As I always tell them, you're doing shots, you're not sipping wine. So just shoot it back and wash it down. Because sometimes it might not always be the most, it's not going to taste like strawberries.
No, it's not going to be like apple juice.
No, not like apple juice. Not always the hard.
There's an epidemic depression, and the World Health Organization is predicting by the year of 2030 that more people will be affected by depression than any other health condition worldwide, not even just here. You're a lifelong medical multiculturalist. What the heck is going on in the world?
Well, I think there's a couple issues with that. One is our diagnostics have gotten a little broader. And I think that, it's okay to feel depressed. I think at a certain, that's a normal emotion for humans to go through. When it tends to linger to the state where it immobilizes you, then that's, clinical depression. Are we experiencing that much more of it? There's a lot on TV now, and the media kind of can really affect people's minds, I think, negatively. I know that when people get diagnosed with cancer, they've told them to do like a media fast. Don't watch the television, don't watch the news for like a month. Because there's always negative stuff that's entertainment to them, and it just bombards the mind. If you watch that all day long, you're going to think that things are closing in on us, and that's one. Two, diets changed, exercise has changed, and I think we need to get back to those things. That's really important. Cornerstone is diet and exercise for sure.
But do you find that the pharmaceutical companies are much more obviously capable with their millions and millions of dollars to get their story out versus Chinese medicine and naturalists? They have no money.
Yeah, exactly. They do, and that's why they are the monsters that they are, economically speaking, they're huge. And Chinese medicine, I think, will always have its path, absolutely. And what I'm doing in my field with the neuroscience and teaching how practitioners to understand it this way and to apply it is just going to root our foot in the future when more neuroscience gets understood.
When it comes to treating the ailments of modern life, which can be heightened by chronic stress, a relentlessly fast-paced life, thousands of year-old healing methods can be some of the best remedies. Can you name two of your best remedies to help us take a step back, calm down, and reduce stress in our fast-paced life?
So, we don't normally prescribe one herb, but There are several herbs that have been known as immortality herbs. And there's in that book, the Huangdi Neijing, the first book on medicine and internal medicine in the world, it talks about these individuals called immortals. And they were supposed to live about 200 plus years old. There is some evidence, I don't know how much supports the 200, but they live very long. And they're known to be consuming several herbs, 3 herbs that are really common. One is Dongchong Shiatao, which is cordyceps, which is a fantastic herb for the immune system. It's a great adaptogenic herb, it helps fight stress. And it's been used even in Olympic athletes to increase their endurance. I use it on my professional athletes that I treat. So that's a great herb that you can take that'll help just boost the immune system, reduce stress in the body. And it's known as an immortal herb.
Where do they get that from? Your doctor again?
Get it from a healthcare practitioner. Yeah,
Okay.
from a Chinese medicine practitioner. You know, they're going to get the best quality of it because these herbs also, because there's high demand, there's a lot of scams. So you have to be careful where you get it from. The other two, one is Lei Gong Teng, which is Thunder God's Vine. It's a really great herb. I even get some and just juice it.
Really?
And juice it with other things, like carrot, apple,
All right, girls,
celery.
we're all going to get thunder. It sounds like Thunder Thighs Gong, but I'm
No,
not going to go
no,
there.
no.
You know, right? It did, right? Come on, it did.
That herb has
And we're only going to be able to get that
actually-
through you or somebody like you?
I could get it
I mean, I'm
for
not
you.
going to go to like Ralph's.
We could maybe even grow some of these herbs here. That would be amazing.
Yeah, that'd be amazing. Oh,
Yeah.
Oh my gosh.
Maybe we can
All right,
make
girls,
tea.
Get ready for next year. We're all going
Special.
to.
And then the last one is
And we're going to be floating the whole week.
Yeah, levitating, just moving to your principles. Then the last one is
I'm
Jiao
fascinated by
Gulan.
this natural. It's so interesting. The exploding popularity of meditation and yoga in the West and the physical mental health benefits are supported by extensive research. We talk about mindfulness and not. But how do you think the more popular mindfulness practices can start to get into the workplace, which is where people are the most stressed?
How to do that, I'm not sure exactly how, but I will tell you that Russell Simmons, the big record producer, wrote a book on meditation, has his children do it every day before they go to school, and was trying to get it into the school systems. They just have the kids meditate for maybe 15 minutes. And I think they got some pushback from religion, and then they wound up not doing it. So I think it's difficult because of that idea, but it is the future of our mind. You want to talk about combating the depression? Mindfulness. Be mindful of your emotions.
I think so too. I think it's very important.
And develop the prefrontal cortex that meditation is shown to do, which downregulates negative emotions.
And we know the millennials are all about balance. They're not like us,
Of
like
course.
crazy baby boomers who are like working like crazy people.
Yeah, that's true
They
too.
are about balance, right? They're not gonna like not have a life and be balanced. What's your advice for people trying to navigate? What's best for them facing all these overwhelming choices?
Well, choices in what? Medicine?
Mm-hmm.
Well, I always tell guests, we all have our counsels in life, right? We have a legal counsel, right? We have our attorneys, right? We have our financial counsels, our CPA and our investors. You should have a health counsel. And your health counsel should consist of a really good internalist or, primary medical physician. Definitely, I would always choose a Chinese medicine practitioner because we have, I think, a very well depth in education on herbal medicine, acupuncture, but also we have to learn Western medicine as well. So when patients come in, we have to be able to see red flags. So we're kind of trained well in that area. Those are the two main ones that you have to, I think, have. I think it's
With Chinese medicine, how do we match it up to herbal supplements? Is that like just a whole bunch of herbs?
No, herbal.
Do you know what I'm saying? How many herbs can you actually take and still not,
Well, I take one formula, what I do is I customize that formula. So Chinese herbal medicine, yes, isn't like one herb. You don't take one big herb, but you would take a formula that might consist of 4 herbs or 6 herbs, and that eliminates one big dose, so you don't have any side effects. And the other herbs work on different systems of the body.
So you take
we
them
have to-
both?
Both what?
You're taking supplements and you're taking...
Yeah, I take some nutraceuticals for my brain, always.
Always.
I always take a fish oil, and I always take an herbal formula. Yeah, those 3 things, always.
Customized just for you.
Customized just for me, yep. Right.
And so what benefits have you seen from taking that?
Well, I was born with a heart condition,
Yeah.
so that's my main thing, is regulating my heart, making sure it's healthy, making sure the blood's thin, moving through all the chambers, also keep my liver healthy, and that also keeps my cholesterol and inflammation healthy, and that's really important. So I take that every day, just to eliminate symptoms and push me farther away from surgery,
Many people often equate the practice of acupuncture with the practice of Chinese medicine. Is it one and the same? Is it part of the whole process?
Chinese medicine is a comprehensive healthcare system. In that whole system, acupuncture is one modality. So herbal medicine is another modality. Mind-body training is another modality. Nutrition, exercise, qigong, meditation. Those are all parts of the pie. Acupuncture is one of those pieces.
So, that's going to take me to a different place. is that something that's rising in American, in Western? Are we getting more healthy? Are we making smarter choices?
I know my patients
Do
are.
you find that more people know Chinese medicine than they would have known before? I mean, I can't imagine in the 50s a lot of people were doing Chinese medicine.
I started in, 25 years ago, right?
Wow.
And when I started, my father and my uncle, who's a nuclear medicine specialist, they all thought I was crazy, right? Chinese medicine, you're gonna what, But now, yeah, it's a lot more accepted. It's a lot more on the news. You see it in, your TV shows and stuff like that.
Well, I have two more questions before I get to my closing question. In traditional Chinese medicine, food is viewed as medicine. Mm-hmm. It's used to nourish and harmonize the mind and body, and all foods have distinctive energy. Can you explain a food or name a food that would help ultimately reduce sickness that has high energy?
I think the leafy greens are always excellent. They're really good for the blood, they're good for the liver, they're good for even the muscles and the heart because of calcium and magnesium. So kale is great, spinach. One food that's like saying, what's your favorite herb? We don't do that. We have a cocktail of herbs, right? Design a formula. And with food, every food does have its nature and its energy, right? So ginger versus cucumber, during the summer, you probably want to eat more cucumber. In the winter, you want to have more ginger. So I don't think there's one food to eat all the time. You always got to keep changing and adapting. And that's the whole concept on longevity with Chinese medicine is roll with the seasons, and adapt to the seasons. In the winter, sleep more. Rest more. In the summer, be more active, sleep less, and go out and do things.
That's great advice.
Yeah.
So, I have a favorite question at the end of every evening, and it is, what golden nugget could you give to our guests tonight that they could take with us that you would help them with dealing with Chinese medicine particularly?
I think one of the cornerstones to health is digestion, and there's so much you can do to heal your body, repair your body, and prevent disease from diet. So I think, try to, obviously, you don't want to be on a lot of medications, but use food as your medicine. And what you do is have a fundamental, nice, clean diet and live in the moment, right? Live in, moderation, but include in moderation. So have fun. You have to break away from it. You can't live so strict. Right. But chew your liquids, drink your solids. That's a Chinese saying. What that means is
chew your liquids and
drink your solids. Chew your liquids. What that means is that our body's 98.6 degrees, and you shouldn't drink a whole big glass of ice water. Wash it around and warm it up before you swallow it. And then drink your solids. First stage of digestion is in your mouth with salivary amylase. So chew as much as possible so that it's pureed. And then when you swallow it, you're already helping your stomach and digestion to extract it. And that guy who lived 250 years, that was one thing two things they commonly noticed from him, from many people, was one, he ate very slow and he chewed his food very well. And the second thing, he never had extremes in his emotions.
Wow,
so mental health and digestion.
So there's our golden nugget tonight. I thank you so much for joining us tonight with just a little chat with Dr. Mike. Enjoy the rest of the evening.
Thanks, guys.